Hello friends, Namaskar. So this is basically the introduction of week number 1 of our course Certificate in Integrative Palliative Care. And in this introduction, we will just tell you what we are going to do in this particular week, and it is very important because here we are going to talk only about palliative care and integrative palliative care and nothing else. And thereafter we will start different modalities of complementary medicines in next weeks, that is from week number 2 to week number 12.
So, just refreshing your knowledge about palliative care. Palliative care is a continuum of care which is given to a patient who is suffering from life limiting illness. Palliative care should be started right at the diagnosis of the disease, and it continuously the care is given till the death of the patient and even beyond the death by giving bereavement support to the family. So, palliative care is a wide range covered continuously in a patient who is suffering from not only patient and family who are suffering from life limiting illness like cancer, HIV, AIDS and many organ failure diseases.
In this week, basically we will be covering the following topics. Our first lecture will be regarding basics of palliative care, then thereafter integrative palliative care and complementary medicine. Then we will talk about important features of palliative care, that is community participation in palliative care, and then 2 parts of communication skills in palliative care, part 1 and part 2.
Coming to basics of palliative care, what is palliation? Palliation is a Latin word. It means to cause something to appear less serious or offensive. Means by covering something so nicely that it becomes less offensive, it becomes good to look at. But as far as disease person is concerned, it is to relieve symptoms of a disease without curing it. So, at one stage you are not able to cure the disease, but you can relieve the patient's pain, symptoms and other suffering and try to improve quality of life of the patient. That is palliation.
What is palliative care? Palliative
This
care,
is WHO definition.
yeah, this is the WHO definition. It is an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment of treatment of pain and other problems, that is physical, psychological and spiritual. So, in short I can say it is basically a holistic approach.
Yeah, and that is what Dame Cicely Saunders described. She described any pain in palliative care patient, it is a total pain. And that pain has got a physical component, a social suffering, a psychological component and spiritual distress. So, palliative care also is a holistic care where you are treating patient as whole.
Then integrative palliative care. In fact, this is the title of our certificate course, Certificate in Integrative Palliative Care. What does it mean? The term integrative palliative care is a new concept within the healthcare community. At its core, it is the use of integrative therapies in palliative care settings. I repeat, use of integrative therapies in palliative care settings. These fields are naturally connected as both are rooted in a holistic model of care that focuses on caring for the person as a whole, multi-dimensional being, mind, body, spirit, environment and relationship. Integrative palliative care focuses on the integration of non-pharmacological approaches in the delivery of palliative care.
Yeah, palliative care not only believes in giving medicine, but also to care the patient by non-pharmacological approaches also, and that is one of the component of integrative palliative medicine. Integrative medicine can have various components like western medicine, allopathic medicine, osteopathic medicine, regenerative medicine, holistic medicine, naturopathy and functional medicine. Integrative therapies can be defined in a integrative medical center. Again, as we said earlier, it can have a meditation, yoga, Thai Chai, music therapy and many other cognitive behavior therapy. You want to add something?
Yeah, basically integrative medicine center will have three main parts: physical part, social part and psychospiritual part. Under three parts, various modalities of integrative therapies will be covered.
That is good.
Complementary medicine. Let's see next slide. I want to tell you few things. Firstly is conventional medicines. Conventional means what we are generally having, and that is allopathy. Second comes alternative medicine. We find out an alternative to the conventional medicines. That is, we stop making use of allopathy and go somewhere else like homeopathy. In India, basically there are two alternative medicines. One is homeopathy and second is Ayurveda. Then comes complementary. It adds to what you had been doing earlier. Understand this particular concept. Conventional means it is basically allopathy medicine which is prevalent all over the world. Alternative, you leave conventional, accept something else. And complementary, you add to what you are already doing. It complements to conventional medicines. Now, complementary medicine is a term used to describe types of treatments you may receive along with traditional Western medicine is nothing but allopathy. Examples of complementary medicine include massage, meditation, biofeedback, Tai Chi, Reiki, music therapy, guided imagery and dietary supplements, etc.
So, complementary medicine goes hand in hand with whatever treatment you are taking. So, it will add quality to add to the quality of life of the patient. So, here is again a picture of complementary medicine and various alternative medicine we talked about.
Yeah, one more thing. You must have come across this particular word CAM. CAM means complementary and alternative medicines. Complementary and alternative medicine. In alternative medicine, basically we have Ayurveda and homeopathy that I have written on the top. So, that whole thing is called CAM. But in this course, Certificate in Integrative Palliative Care, we are going to discuss only complementary and not Ayurveda and homeopathy. So, basically we will be dealing only with complementary medicine.
Thanks for that clarification. In this week, we are also going to learn community participation, which is a very important part of palliative care, because this patient is suffering from a long time disease and he lives in community. When he is suffering from such disease for 5-7 months or even 5-7 years, then of course community has to gear up to support this patient, and that is where the community participation comes.
Yeah, dear friends, I want to tell you two basic, very, very salient features of palliative care, which you will not find in any other medical stream of the world, any other medical stream. And those features are, Firstly, community participation. Community comes up, they have the volunteers, they establish community-based palliative care, manned and financed by the community all around. That is the community-based palliative care. Community's importance has been taken out. Community is being empowered, number one. Number two, we lay lots of emphasis on communication. Communication with the patients, communication with the family members, because communication is being taken as one of the therapeutic treatment. Am I right?
Yes.
Yeah.
Yeah. So, good communication is need of palliative care services.
Why do we go for community approach? Will you tell them, please?
Yeah. There is a need of continuous care, as I said earlier, and attention for the rest of their life. And there is also need of regular social, psychological and spiritual support to this patient in addition to medical and nursing care. Community approach, here the community people are readily accessible and available as close to the home as possible. And the community approach enhances the integrated care for all diseases in all stage of the diseases. Enough social capital is available to build up a safety net in the community around these patients, and that is why community approach is necessary.
Now we come to the second most important feature of palliative care, which you will not find anywhere in any medical stream, that is called communications. Communication skills I divided into two parts. In part 1, we will deal about communication in general, and then we will talk about the importance of empathy. Now, what is communication? Communication like tumors. This is the medical definition I am giving you. Communication like tumors may be benign or malignant. May be benign or malignant. They may be invasive, and the effects of bad communication with a patient may metastatize to the family. Normally also we always say okay, good language, bad language. Good language has got lot of effect on the people who are listening to it. Bad, yes, immediately if you abuse somebody, you will just see that his or her mood goes off, you know. Nobody likes bad language, nobody likes bad temper, anger or other things. And therefore, it is said communication can be benign, means good communication, you cheer up somebody with your communication, and another angle is communication can be bad, malignant, that it produces depression, unhappiness in somebody's mind. In another word, we can say the transmission of information, thoughts and feelings so that they are satisfactorily received or understood. This is important, Dr. Gita Joshi. Why? Because after all, lot of information will go between patient, families, doctors, nurses, and therefore, all those information must go out quickly, briefly, concisely and precisely.
And it should be same. Doctor, nurse and the whole team should talk on the same point with the patient and caregiver. So, goals of communication is to reduce uncertainty in patients. Many of the time patient and relative doesn't know what is going on with them, and they are very much anxious and afraid to go to a hospital or a doctor. So, a good communication will reduce the uncertainty, it will enhance the relationship between the doctor and caregivers, and it will to give the patient and family a direction in which to move. It will help the patient and family to take decision, and it will give lots of satisfaction on the part of healthcare team as well as for the patient and family.
Now, this is the second part. I just said we will dwell on these few words, apathy, pity, sympathy, empathy and compassion. In short, apathy means no interest, you are neglecting somebody. Now, medical team including doctor and nurses, they should not show any apathy to the patient. They cannot neglect because it is their moral duty. Pity is a feeling of sorrow caused by the suffering of others. It is general, it is never towards a particular person. Sympathy, that is what is important. It means you understand the feelings of another person, you just understand. But a step higher than sympathy is empathy. You understand also as well as you feel the same pain in your heart. Therefore, in palliative care, no, not even in palliative care, everywhere, even in social circles also, we should be always empathetic to the people all around. We must understand them as well as sometimes when they are in agony, they are in depression, we must feel what they are feeling themselves, And last comes the highest term called compassion. Compassion, in Sanskrit we call it karuna. That is what generally God shows compassion on all the humanity, in spite of our blunders and mistakes and other things. In compassion, another factor is there, empathy, plus you take some measures. Like most of the medical institutions, educational institutions, they have been built as a matter of compassion for the welfare of the society.
The last lecture in this week 1 is on communication skill in palliative care part 2. In this, Colonel Yashwant Joshi has described many good tools about the communication. You can describe them?
Yeah, this part 2 of our communication is basically relates to the methodology. What tools do we have, and the use of those tools will give us some sort of mastery over the communication, and particularly communication in medical profession. So, we call it 6-point toolkit. Like a toolkit is always there with your vehicles. Whenever something happens, some puncture takes place or some small errors in the machine or here or there, and if you know little bit, you can just take out the toolkit and repair it and go ahead. Similarly, here also 6-point toolkits are there. If you make use of it, your communication will be very good. Comfort, there is a setting when you speak to the
Comfort means first of all,
comfort basically it's a setting. Whenever you take the interview or whenever you have a dialogue with the patient, how they sit and carry out their direct dialogue. That is provision of chairs, privacy, no distractions and all those things. Language, it should be that language which patient can understand. Question style, it should be always open and not closed style. Active listening, doctor is supposed to listen to the patient, let him say anything, because if patient says everything about his problems, then a proper case history can be created and you come to right type of diagnosis, reflecting, thinking over, and then you have to summarize the whole interview. What is the diagnosis, how the medical plan, treatment, all those things need to be explained.
so this is the basic toolkit which all healthcare professionals should have before starting a communication
Yes.
with a patient and caregiver.
And this is the class protocol. Again, it's generally the same thing. It is basically the replica of the toolkit only, but we are given an acronym, class protocol. Protocol means a particular design of methodology has been given to you so that you do not miss out. Now, what is the class? It is there in the next slide. So, it is not there. Class means C means context, the setting. L means listening capabilities, active listening. A means acknowledge. Acknowledge means you acknowledge the feeling, the thought process of the patient. Don't laugh it away. S means strategy. What sort of medical plan you are formulating so that the patient problems can be reduced. And last S is summary, the everything in total, in brief, so everybody knows what is to be done next.
So, at the end of each interview or meeting with a patient and caregiver, you have to summarize the things. So, next when you plan the next interview, you know that what things were discussed and what needs to be discussed in this present interview. I think this is all about the
First week,
week 1,
yeah,
where we are going to teach them basics of palliative care, basics of communication, basics of community participation, and about integrative medicine and about complementary medicine.
one last request to our students and viewers, like you are listening to us in the first week, we wish and we expect that you will listen to us in the 12th week also. That means you will complete this particular course, certificate course in integrative palliative care. Our aim is not to make you doctors. Sorry, we don't want to make you doctors or anything, but we are telling you, we are going to talk to you, we will speak to you, we will show you some simple therapies which can be tried by all of you. You learn something more, you see it here or there, and then thereafter total preventive medicine, you will be able to master it. You may not have to go to any doctor at all. That is what I wish. Thank you. Thank you, friends.
Thank you.